A lot of parents often ask me about growing pains. They are often concerned about them in their kids. Now, growing pains are a benign and a very common phenomena that occur in the adolescent age group, mainly between the age of 8 to 12 years. However, they can also occur in kids as young as 3 years. They often occur with the legs, especially in the calves, back of the knees, thighs, and they can also happen in the heels and the knees. Why do they occur? They usually occur after a period of rapid bone growth in this age group, where the muscle growth cannot keep pace with the bone growth. As a result, the muscle stretches to keep its length along with the bone. Now, this is very normal and it resolves on its own over a period of time. These pains usually occur at the end of the day or following some form of exercise or sports. Now, these pains normally do not need any specific treatment. They can be treated by normal warmth or simple painkillers. The child should be encouraged to do stretching before and after an exercise. However, if there is redness, fever, or any other non-relenting kind of symptoms which do not improve, you should consult your doctor immediately.